Hi, I'm Dr. James David Elner. I'm in Woodstock, Georgia. I'm an interventional pain physician. I'm here to discuss my practice and a new technique called spinal cord stimulation. What I do for a living is I treat patients in pain, and typically I get patients after they've seen their primary care as orthopedic surgeons and they continue to have pain despite conservative therapy, including physical therapy, acupuncture, massage therapy. By the time I see the patient, they typically need something a little bit more involved. After imaging and trying to find out where the pain is actually coming from, typically patients undergo procedures where our image-guided procedures where under live x-ray I put a needle and either inject medicine or burn nerves where I think their pain is coming from. Sometimes patients have to be on medications. Despite all of this, some patients unfortunately don't get better. Recently I began doing more and more of what's called spinal cord stimulation with a company called Nevro, which does high frequency stimulation. It's extremely effective for both back and leg pain. I'm very fortunate today to introduce Sean, who's a patient of mine, and he's going to discuss his treatment.
I'm pleased to discuss it because for 10 years I've been dealing with the problem. I had a fall at home. I fell off a ladder about 3 foot off the ground while cutting a bush and landed between my neck and my butt with my feet in the air. Well, they hospitalized me for about a week, and they determined then I had compression fractures of the 3 lower vertebrae. For the first couple of years I dealt with massage and TENS units and various other procedures trying to alleviate the pain, but it wasn't going away. I was referred to Dr. Elner's office here, and it feels like I know everybody on the staff now because I've been here so often over the years. And I guess I've been dealing with it for about 8 years. We went through various burning of the nerves and tried different medications, and not so much on the pills because I was a little hesitant to establish any kind of dependency for that kind of therapy. So we got to the point where the pain was starting to radiate from my spine down through my right hip, down through my leg. And at that point I became frightened. So we talked about it for a while, and he referred me to take a look at the spinal cord stimulation company called Nevro. And he handed me some pamphlets, and I went home and did some research and talked to a friend of mine who has a similar device implanted in his back. Well, I decided to try the procedure and went through the test where they inserted the wires in the back, and I wore a battery pack for a week, and that worked out great. I mean, I was impressed. The pain was gone and I was feeling good. Well, they went in for the permanent implant where they put a battery pack just over one of my hips, and they put the wires in my back. And when I woke up from surgery that morning, since that morning, which was in March of this year, to now it's October, I have not had the pain once. I was impressed. And everybody keeps asking me, oh, do you need to turn it up? Do you need to turn it up? No. And they said, well, do you still have pain? I said, well, the pain is there, but it's just blocked the signal that is going to my brain, so I don't feel the pain. I mean, I'm thrilled with the procedure. In fact, I wound up counseling other people who've had back problems, and I said, you need to ask your doctor about this. So I've been impressed with it, and from the bottom of my heart, I thank you, sir.
You're very, very welcome. this is why you go into medicine, is for success stories like this. You have a patient who had a poor quality of life, and ultimately he's doing great. So we're very happy with it.
Thank you.
You're very welcome.